This is Priyanka Sarkar, and welcome to the Sport Soul, a space where we explore the real stories and emotions behind strength in sports and in life.
Growing up is messy enough. Identity, friendship, relations, education, exams, future plans, it's all messy. But for teenagers and adults with ADHD, it is even more difficult. People look at them and think they are lazy. They do not understand the chaos that happens within the children of ADHD. And ADHD is always often misunderstood. People picture a hyperactive kid and they think that the patient or the kid has ADHD. But that is not ADHD. Today, I have a clinical psychologist who will take us through what happens inside the mind of a ADHD child and who is qualified to work with an ADHD child, or what is that we as a community or support staff or support system can do to help the children with ADHD. Thank you, Snigdha, for gracing one episode of the Sports Soul podcast.
My pleasure.
This episode is personally of more of a learning experience, like every other episode when I have a guest, because I work with ADHD players and they play various sports. The reason why children are put in sports is so that they can align their minds accordingly.
Right.
Before I can start off, I want to ask you to tell me a little about the educational qualifications one needs to have to become a clinical psychologist, the work that you do. Start off by telling a little about you, please.
Okay. So I completed my master's and my MPhil from Delhi. In order to become a clinical psychologist, I think we need to specialize in clinical psychology, more so MPhil. But however, the nomenclature has now changed. I guess it will be now known as MSc in clinical psychology. So MPhil requires, back when I did it, it requires 2 years of rigorous training. Now, the first year, I remember being posted in wards and OPDs. I worked extensively with clients with various illnesses, ranging from anxiety to something more severe like schizophrenia. Now, we did a lot of psychological assessments with them, a lot of case history taking, MSc and everything. Cut to second year, we actively engaged with them. Now, by actively engaging, I mean we did a lot of psychotherapy. So which includes CBT, DBT, behavior therapy, and so on. Now, like I said, it's extremely intensive and rigorous. So these 2 years involved us working in wards, us working in OPDs, and different specialized clinics like neurology. Then there was psychiatry, of course. And then we also worked in the child guidance clinic and so on. So I think in a way, these 2 years, while they were very rigorous, they prepared me for what life had to offer. And of course, other than the clinical exposure, we had a lot of academic exposure as well in terms of presenting cases, presenting, working on different papers and presenting them, research work, the dissertation, and of course your regular papers that everyone has while they are pursuing any course. So yes, I think to sum it up, this was what my MPhil experience was all about.
Thank you for that. But I want to ask you something. So when somebody completes an MSc clinical psychology, you said they receive a license.
Yes.
So are they eligible to start working with patients right away, or do they have to complete an MPhil, something like that?
I think MPhil is now known as MSc.
Yes.
If you go by the recent notification by the RCI. So the moment you complete your MPhil back then and MSc now, you are eligible to practice. You can have your own setup.
Are clinical psychologists allowed to prescribe medicine?
No, no,
Okay.
no, they are not.
Not even somebody who has done their MPhil or PhD?
No, that's exclusively the domain of a psychiatrist
Okay.
who has an MBBS degree, and then they'll do their MD in psychiatric medicine.
So when you meet teenagers with ADHD, how does it look like day to day, or how different it is from the stereotype that people have in mind about ADHD children?
Typical idea that people have when it comes to ADHD is you can imagine a child who is jumping from one sofa to the other sofa, is extremely restless and just can't sit in one place and so on. But in reality, ADHD is more than all that. ADHD, of course, as the name goes, it is inattention, it is hyperactivity, restlessness, impulsivity. These are the core features of ADHD along with emotional dysregulation. So when I meet teenagers who have ADHD, typically I come across a lot of academic struggles. So they find it very difficult to, stick to their deadlines. They find it difficult to, finish their homework. They constantly, it's like they can start a work, but they find it very difficult to finish the work. So task initiation is not a problem, but task maintenance is. Now, academic struggles can be in the form of, task management, or, sometimes, they keep losing track of the things that they have done. So that is something that is very problematic in them. And other than that, they are also very prone to making careless mistakes, right? So while all these things are happening, there are a lot of emotional challenges and social challenges that they face. These emotional challenges could be in the form of extreme anxiety, depression, low frustration tolerance, and something very specific to ADHD, which is known as rejection sensitivity. They're very, very sensitive to any kind of rejection or even perceived rejection. These are some of the challenges that typically teenagers face, and because they are in their teenage, there's also a surge of hormones, which makes them very, very prone to risky behaviors. Like they'll be shopping a lot, they'll be into substance dependence, they can't even engage in risky sexual behavior. So all these things are typically seen in ADHD teenagers. Other than that, I would also like to, bring to your notice the gender differences.
Yes.
Unfortunately, ADHD goes unnoticed in girls because it's more the quieter type. So it's more of the inattention and emotional dysregulation among girls as compared to boys. Which is why girls tend to get underdiagnosed with ADHD. So this is the typical profile of a teenager who has ADHD.
May I take a detour and ask you something? You said they also show signs of depression. But there is a difference between sadness and depression, where we often confuse ourselves whether we are sad or depressed. When I work with somebody like players, they say, I'm depressed. I'll start away ask why. Do you think you're depressed? Oh, yesterday I lost a match. But depression is a clinical condition which is built up on a series of events that must have disturbed your system. Sadness is just one event. You get over it after a period of time. How does depression show up in ADHD children?
So, like I said, ADHD is a lot about social and emotional challenges as well. Now, imagine this. A child is trying very hard to finish his work. But then, of course, there are a lot of other difficulties that he's facing, like making careless mistakes or genuinely forgetting things or unable to keep pace with other people because of the fluctuating attention. Now, he gets pulled up for this. Not just by the teachers, but also by the parents. And sometimes because of this habit of constantly interrupting others, which is also a part of the ADHD, it also affects their relationships. Now, when they are constantly getting bombarded by words like you are lazy, you do not have any manners, you don't know how to do work, or a lot of other kinds of criticism, it is bound to affect their self-esteem. And once the self-esteem goes down, sadness is something that is very common. But here's the difference. When you're speaking of major depressive disorder and sadness, like you rightly pointed out, it's about the duration, the frequency, and the intensity of it. So sadness, I will feel sad about losing a match. But if I consistently feel sad, if nothing makes me happy, if I have lost interest in talking to my friends or anyone, if I don't feel like doing any work, if I'm constantly burdened by guilt, if I have no wish to live, and when all these symptoms happen for a longer duration of time and I feel them very intensely, then I should just visit a psychologist or a psychiatrist to find out if I am actually having clinical depression or not.
Thank you so much. But, a lot of misconception comes from the way we articulate.
Yeah.
Kids might say, I'm just lazy, I'm not interested, or they also might say, I'm not smart. From a psychologist's view, what really is going on in the brain when they say, I'm not smart, I'm not interested, or I'm lazy? What is happening behind in the brain of these kids?
So I actually feel very sad when I hear words like lazy or I'm not smart and so on, because it's It's a very sad narrative that the kids are constantly giving themselves or feeding their mind with. Whereas in reality, it's not about smartness or it's not about laziness. It has more to do with the wiring and the structure of the brain. So, if you look at the brain scans of people who have ADHD, even the research says that there's a problem in the executive functioning and also the way the dopamine is circulated. Dopamine is a neurotransmitter in our brain that is also responsible for a host of other disorders, but specifically in ADHD, it's more due to executive dysfunction rather than laziness or a child not being smart. Again, it's also about your dopamine dysfunction as compared to or the way the dopamine is circulated in the brain as compared to laziness or not being smart. So it has a lot of neurological underpinnings rather than the words as these kids associate themselves with. I always feel that children who have ADHD, they are very sharp, they are very brilliant. It's like having a nice, beautiful SUV, but you find it very you struggle to manage the brakes and the accelerator.
Yeah, because you don't know which one is it.
You don't know which one is it.
Yeah.
So your brain is in overdrive. When do you apply the brakes? At what point and how much is what ADHD kids struggle with. So this is what I feel about students and children, of course, who have ADHD. It's just a different kind of wiring, that's all.
Few people slip into the cracks of misdiagnosis or they're not even diagnosed. And after a later point in time, maybe in the later ages of their life, like young adulthood or adulthood, like when they start working, is when they're diagnosed with ADHD.
Yeah.
When a young adult who has been misunderstood all these years finally gets diagnosed, what happens then?
Well, it's usually a mix of relief and to a certain extent even grief. Relief because they now understand what was happening to them all along. Everything makes sense. Every symptom or every problem that they had while growing up, it makes sense now. They're able to understand why things happen the way they happen. And all the narratives that they spun about themselves in their mind, that they're lazy, they're not smart, or they're not loved and so on, are not because of all the things that they thought, but it is because of proper diagnosis.
Yeah.
Now, grief because there's a lot of pain that they had to go through while they were having ADHD. It's not easy, like any other diagnosis for that matter, it's not easy being diagnosed with ADHD because it comes with a host of problems.
Yes.
So while one is dealing with that, and there's this loss, or there's a sense of not living enough, or probably that comparison that people start making in their minds that, oh, look at my friend, they never had ADHD, but I did.
Yes.
When these comparisons happen, and when they think of the things that they lost because of ADHD, it brings in a lot of grief.
Yeah.
So typically I've seen relief and tremendous amount of sadness and a little bit of anxiety because what next? What do I do now?
So I'll come to that now. What to do, what next? So let's say there are diagnosed kids who have been in school, who have to go through a structured and organizational phases of life. So you wake up at so and so time, you catch a bus at so and so time, you have a class at this time. There's organized structure. But once you start working, the organizational structure is not there. Of course, you have to go to job and office at 9 o'clock, come back at 5. But what you do within that time, like 8 hours or 9 hours, it's not organized. Someday you'll have a meeting, someday you'll not have a meeting. Someday you might have paperwork, sometime you might just have clients call to attend. How does this transition from an organized life structure to not so organized life structure works on people with ADHD?
It's a little difficult for a very simple reason that structure is more like giving oxygen to people who've been diagnosed with ADHD. It provides some kind of a scaffolding. In absence of that, they struggle a lot. What do they struggle with? They struggle with time management, they struggle with organization, their work, organizing their work, they struggle with their emotions, they struggle with managing their social interactions. A a lot of issues that I discussed even earlier, like missing out on deadlines or making careless mistakes. So these are the things that become more and more common, because earlier there was a structure. They know what was coming next. But in absence of that, it can be a little stressful. While freedom has its own thrill, but it comes with a price. Now, this lack of external structure and the demand of independent executive functioning puts in a lot of pressure on them. All the issues that we discussed on earlier, like this anxiety, guilt of not being enough, sadness of not being enough, or constant comparisons with other people, rejection sensitivity, irritability, anger, all these things start coming up again and disrupt the life. So without any external anchors, people tend to just spin out of control, which is why the timely diagnosis and proper scaffolding in whatever structure they are working right now can also help.
So when you said timely diagnosis, so that's where I want to ask you something. So do people with ADHD need periodical diagnosis or something of that sort? Or I just want to know, once diagnosed with ADHD, can you explain the timely diagnosis part?
ADHD is more like, if let me make an analogy here. So let's say that I get diagnosed with diabetes, right? I know how to manage it, to keep all the levels in control. So it's more or less like that. Once I get diagnosed with ADHD, and once I am aware of the severity of the ADHD, I have to work around it and manage my life accordingly across different domains. So if I'm able to do that, sometimes with the help of medication, sometimes without the help of medication, if I'm able to do that, then life becomes a little more manageable and predictable. Like I said, structure is like oxygen. It provides some kind of scaffolding to a person who's been diagnosed with ADHD. So when I give back the structure with, of course, when I get diagnosed on time, and again, timing, when I said timely diagnosis, it's just more like a wishful thinking.
Yeah.
Because a lot of people, like you said, slip through the cracks. So if parents are aware of the symptoms, if parents are have a better knowledge of what ADHD is, or what are the different kinds of disorders that children have, and if they're able to recognize these signs and symptoms and take the child to a psychologist or a psychiatrist, maybe timely diagnosis is something that can happen.
You said structure is very important. It's like oxygen to them.
Yeah.
And for somebody with an ADHD, one of the structures that might help is friendships, relations, family. How does ADHD shape friendships, relations, dating, or early romantic relationships?
So ADHD symptoms can help people in their relationships, or can also come in the way. Now, when I say they come in the way of a person's relationships, it could be in the form of communication difficulties, or forgetfulness, or being unreliable. Now, what do they forget? They forget some important dates. They forget upon agreed upon responsibilities. So they might forget their share of work, leading to unnecessary strain over the other person, and that might create a strain on the relationship.
Yes.
Saying that you promised me that you would work, but you are not working. How could you forget that? How many times do I have to tell you that you need to do work? You need to work on this, or you need to finish this task. But what is happening in an ADHD person's brain is not that I want to forget. It just slipped out of their mind.
Yeah.
So that can create some kind of misunderstanding. Again, when it comes to communication difficulties, inattention is a cardinal feature or a cardinal symptom of ADHD. Now, when someone's attention is constantly drifting away, they may not be as involved in a conversation as you want them to be. Now, what happens is, if I'm talking to someone who has ADHD and I'm having a very heartfelt conversation and I see them drift away, I would, construe this as a sign of indifference or as a sign of disinterest. And in a way, I would feel very, rejected, or I'd feel disrespected as well. Yeah. That why is this person not paying any attention to what I'm saying? Whereas it's not something that they're doing because they're disinterested or because they want to disrespect you. It's just the way the disorder is. Their attention keeps drifting away from one place to the other place, and they have to marshal all their attention to one person. It takes a lot of effort. So this is another problem that they have, and I've talked about emotional dysregulation and rejection sensitivity as well. They often experience very, very intense emotions on account of all the problems that they have faced. And again, it also has to do with the wiring of the brain, where the emotion bit also finds the part that controls the emotion also finds it very difficult to regulate that bit. So when all these things come together, they also create anger outbursts. They make these people very irritable. So, and nobody wants to be at the receiving end of someone's anger outburst, or nobody wants to, be chided by someone. So when all these things happen, it will have an impact on the relationships.
Yes.
People who have ADHD, once they know that they have ADHD, they will of course be more cognizant of these factors, and they'll try to invest more in the relationships. And also for the people who are living with the ones who have ADHD, once they are aware of these symptoms, they take a more compassionate approach towards these people, and they won't take offense to the things that they would usually take offense to earlier. So these guys also tend to be very, very spontaneous. So they also can be very, that's the bit with emotional intensity here. So it can make a person very angry. It can make a person flip out, but it can also make a person very deeply invested in the relationship and actually show physical signs of love. So these are the different ways in which, ADHD can have an impact on the relationship. It's like a mixed bag.
You said a mixed bag, and you also spoke a lot about rejection sensitivity. And no matter how much it hurts. Rejection sensitivity, even for me, if somebody says no, it might hurt me.
Absolutely.
It might hurt you, everybody in this room. And it hurts the ADHD people a little more. If somebody has ADHD and is listening to this and is going through a rejection right now, how do you think that they can work around it so that, without shutting themselves down, how do you think they can work on it?
For those who don't know what rejection sensitivity is an extremely intense emotional reaction to rejection or perceived rejection. Now, when I say perceived rejection, it means that the way I am looking at a situation and what I am perceiving out of it. So it may or may not be based on facts. So there are 4 R's that I would want you to remember. It's recognize, respond, reflect, and refrain. So recognize the symptoms. Immediately when you feel a sense of rejection, try to identify what are these symptoms, where exactly are you feeling them in your body, and what is happening in your mind, what are the kind of emotions you're feeling. This is a recognition bit. Now, responding, how do you respond to them? There could be a lot of techniques that you could use, like just being in the present, trying to use some sort of cognitive reframing or cognitive restructuring, where I would probably try to tell myself or try to find out different ways of looking at the same situation. For instance, if my friend doesn't pick my call up, I instead of thinking that she doesn't like me or she's ignoring me, I would think, okay, maybe she's busy with something.
Yeah.
Or she'll get back to me later. She's always picked up my calls. Maybe this is something, maybe she's occupied with something else, or so on and so forth. So this is some kind of cognitive reframing. So I'm turning this rejection bit by giving it a more neutral color. Now, the reflection would be what exactly is happening. I mean, while I'm doing restructuring, I'm also trying to look at the objective facts. Is this actually rejection? What do I mean? What do we mean by rejection? And do they have the power to reject us? And are we giving them the power to reject us? So that is one thing. And of course, the last one would be, to refrain from any kind of reaction. It comes very naturally to people who have ADHD that they react like this. So when they pause, when they just hold back their reaction, and when they engage in recognizing, responding, and reflecting, they will be more successful in refraining or holding back the immediate emotions that they experience.
And I want to talk to you about something, the gender based information that you spoke about. You said girls are underdiagnosed because they're more the calmer ones. But men, they're asked to slog. It doesn't matter as a man, you're not supposed to complain. And with somebody with ADHD, uh, especially men who are always told, uh, be successful, don't complain. How does it affect men? And how does the pressure land on someone with ADHD in the male gender?
Cultural pressure tends to be very hard on men, given the kind of narratives that a lot of men grew up with. Uh, this results in a lot of shame, anxiety, low self-esteem, and to add to the troubles, so they also are taught to suppress their emotions and not talk about it. So I haven't, it's nowadays, of course, this scenario is changing, but men, I think, often struggle to say that yes, I am having depression, I am having anxiety, or so on. Again, there is a lot of this constant pressure to meet high expectations, combined with the additional requirement to manage ADHD symptoms. This often results in high stress and anxiety, and this can lead to a vicious cycle where anxiety impairs their focus and performance, leading to more stress. Now, emotional dysregulation will again complicate the matters further, because they are suppressing their emotions in the first place. So to address that and to get an appropriate solution for that is also something that complicates the picture further. And lastly, I think stigma plays a very important role. When you are constantly listening to things like men don't cry, men don't complain, mard bano, you're a big boy. When they keep listening to all these things, they really don't know how to navigate through these difficult emotions and how to articulate them, more importantly. So when all these things, are bottled up, or when all these things, they snowball into something bigger, which can lead to increased amount of anxiety, a lot of anger issues, a lot of irritability, a lot of, shame. And of course, all this might have an impact on the self-esteem too.
So all these, when built up, they might cause stress, anxiety, burnout. And one of the ways people let it out is through substance abuse.
Right.
How do others, like how can families or support system can look for people with ADHD so that they don't burn out or they don't get into substance abuse very early on? How do we make sure that they are not burned out, or they don't get into substance abuse?
Coming to the support system, I'm assuming that when you say support system, you mean the family,
Yes,
or the teachers, in case of teenagers, and maybe good friends. So one of the ways in which this can be, handled is by the support system, or the people who are forming a crucial aspect of the support system, educating themselves about it, being more open, and adopting a slightly more compassionate attitudes towards these people, because they're genuinely struggling through a lot of issues on account of ADHD. Now, having said that, once we provide them the necessary emotional scaffolding or support, we also need to help them with having more structure. Like I said, structure forms an integral part of a person of ADHD treatment. So instead of criticizing, if you start collaborating with them, instead of pointing out the things that they have done wrong, you can sort of be more supportive and tell them how can they improve their performance, or whatever task that they're working on, or even relationships. So for instance, a teenager who has ADHD is constantly interrupting. So you can gently point it out to them that, yes, I understand you're very enthusiastic to contribute to the conversation and all that, but I would also request you to just wait for the other person to finish what they're saying, and then you can obviously make a meaningful contribution to the conversation. So if you see that there's a slight change in the tonality, so from saying that, don't you have any manners, how are you interrupting me in the conversation, learn to respect your elders. अरे मुझे खत्म तो करने दो, बोलने लग गए. So from that, you are saying, yes, you seem very excited. Just give me 1 minute, let me finish, and then you can also say. And then subsequently, you can also tell them that, I know I see this, so maybe it will be nice if you just give them some time to finish what they're saying, and then you can contribute. And how is this happening? Once you educate your client, once you educate the parents about what is actually happening, they'll know, okay, I'm doing this not because of some ill intent, or not because I'm impatient, or not because I want to be disrespectful or cut the other person off, but I'm genuinely not able to, control that urge to speak. So I'll hold myself back. So delaying that gratification and holding on, refraining from immediately interrupting someone, all these are skills that they keep working on regularly. So that is also something that the support system can do. And of course, making sure that they are meeting their mental health professionals on time, showing interest, and working through their, trying to understand their emotional ups and downs, and working through it by providing more and more support and understanding, and taking medication if required. So all these things are the way in which people can be more supportive. I think compassion and being more aware and having an open mind is something that is really important in any kind of treatment, more so in ADHD.
That's wonderful. You said that, when somebody is talking, and when, let's say, like, there's a teacher who's talking in, the student tries to pitch in, and then you just alternate the tone and be compassionate and understanding, but also respect the fact that there are other students in the class. This is a neurodivergent talent. I would not want to call it a medical condition. It's a neurodivergent talent. How can universities or schools make these places a place of better support for this talent?
Okay, so we can always start with assuming that neurodiversity is already existing in the room. So when you start with that kind of belief system, you are able to plan better, right? So what do? We'll have flexible deadlines, we'll have quieter workplaces, or a place that has less distractions, or we could have some mentorship programs or trained supervisors, or we could provide more structure to the students. Like in my university, we have the mentor-mentee system. So there are a group of around 20-25 students, sometimes even less. They have one mentor. So for any kind of issues that these people have, they report to the mentor, academic, non-academic, anything. So again, providing structure, providing emotional support, understanding, and a genuine interest in the student can definitely go a long way. Flexibility again is the key here.
But workplaces, they run on a business model where, yes, there might be compassion, but unfortunately, empathy doesn't pay our bills. It helps us get better, but it doesn't pay bills, to be honest with you. We all know that. And how can workplaces be supportive of ADHD people or ADHD neurodivergent workforce? Or are there any specific careers that might benefit the ADHD people?
To begin with, I think we need to get this thing very straight, that ADHD is not a handicap. Now, workplaces specifically can leverage on ADHD strengths, like they're hyper-focused on work. This is the other side of ADHD, that they can, when they focus, they can give 100% attention to it. Either it will just wax and wane, but if they do, it can be hyper-focus. So they, like I said, they can leverage on ADHD strengths like creativity or hyper-focus, or that restless kind of energy, that hyperactivity, that high energy, so to speak, quick thinking. All these strengths can be, put to use. And what kind of jobs? These people can work in newsrooms, which are very high pressure, and things are constantly happening in a newsroom. You need to be on your toes. You need to be very, very quick with your decision making and all that. You can be impulsive sometimes. So these are the things that they can probably experiment with. Other than that, they can also be into advertising, because they're very creative. And advertising needs a lot of creativity. These guys can also have their own startups that require a lot of exposure to people, or that requires, let's say, some kind of creativity.
Technology and AI are everywhere. Now, technology has brought in apps, planners, and everything. For an ADHD child or a young adult, is this helpful, or is it a distraction?
It can be both. A planner will not fix your executive dysfunction, but it can support it. There are a lot of apps that play the supporting role in the life of a person who has ADHD. So if I have planners, if I have deadlines, if I organize my tasks with these to-do lists and so on and so forth, it is going to provide some structure. Now, I'm talking about all these apps. Now, how can they be disruptive? Because when there are too many, you get distracted by them. You don't know which one to pick.
Yeah.
So usually picking some apps that have, some very, very core features, so some very, very important features, and try when we start using them exclusively, that probably will cut down the rate at which the attention keeps wandering. It'll be more focused. So to answer your question, if technology and AI is going to impact them in a positive way or in a negative way, I would say it can be both a boon or a bane, depending on how it is being used.
It is most of the times it's the parents who take care of everything when rushing for schedules, deadlines and everything. It's the parents. So at times the children might feel controlled. If there is a parent of a 17-year-old or an 18-year-old, or even let's say there is a parent of an ADHD child, how do you think the parent can work around the child so that they make them feel independent and not controlled?
Okay. So I think the focus should again shift from control to a more curious and a compassionate and a collaborative approach. Curiosity about what could be the reason. Why is the child behaving or the teenager behaving the way they are behaving? Having some kind of an open mind, trying to be more collaborative. Instead of saying, oh, you did not do the task. Or is there any way in which I can help you out? What are you struggling with? Is there anything that is coming in your way? Trying to understand what is actually happening and trying to be more collaborative. Also having a lot of empathy, because they are struggling. Like I said, they're struggling a lot. So when you tell them, just a word of reassurance that I know it can be very hard. I know you're struggling. I know the kind of effort I see the kind of effort that you're making. Acknowledging them for their efforts and telling them that they are being noticed, they are being seen and heard. This kind of empathy makes a person genuinely feel seen and heard, and they will be a change in the teenager or in the child. So this kind of empathy, this kind of collaboration, this kind of compassion will go a long way. And also having very clear expectations. Clear expectations are a part of our structure. Too many instructions, they get confused. Their mind gets all muddled up. But if you give them a clear set of instructions, they will be able to follow it to the T. And the task also gets done. So there will not be this, anger on account or irritability or disappointment on account of unmet expectations that parents or teachers usually have. So these three approaches, I think, being compassionate, being collaborative, and having a clear set of expectations from the child can guide them better. So the idea is to shift from commands to a more guided problem solving. You can empower the person or basically the individual with ADHD to be more responsible and also build in a lot of confidence which they lack.
So we have spoken about what needs to be done or what is good for them. But if there is one thing that workplaces and educational institutions can do something that they're not doing, or if they can change one thing in our educational institutions and workplaces in the way systems treat ADHD patients, what would that be?
It's actually hard to just pick one thing because there are a lot of ways in which we can support them. But I would go with flexibility, right? So flexibility in terms of knowing that not all minds work in the same way. So if I'm in a neurodivergent workplace, or if I'm in a neurodivergent classroom, I need to assume that every person has their own way of working. They work at their own pace, with whatever, they work at their own pace. Now, giving them allowing people to demonstrate their brilliance through multiple pathways, not just deadlines.
As a last question, if I have to ask you, what is that one small change in our educational institutions or our workplaces can do uh, around the systems in the way we treat ADHD children? What would that be, and would that make a big difference?
See, it's hard to pick just one thing because I believe that we need to look at ADHD and we need to provide support in as many ways as possible. But flexibility is one thing that I would want to, choose out of. If I have to choose one thing, then maybe flexibility is one thing that I would pick, because every mind works in its own way. By assuming that all brains work in a similar way or one size fits all, it's not going to help us in any way, whether it's an educational institution or whether it's a workplace. And we need to have different parameters or of understanding a person's worth, of understanding a person's contribution. So having let's say more scores or having better scores or meeting a particular target may not always be the best way to understand the capacity or the productivity of a ADHD individual. There are multiple ways in which they can shine. There are so many other ways in which we get to know how their beautiful mind works. So understanding that, being more flexible in terms of setting goals, in terms of understanding tasks, in terms of giving them some tasks, like what kind of task will suit a person while you're delegating responsibilities, being more flexible with that, and also sometimes a little more flexibility with deadlines, a little more. These things, I think, these kind of adjustments can definitely help people in the long run.
That's quite beautiful, and my hope is that this episode opens eyes and this becomes a moment of recognition for a teen who feels misunderstood, for a teacher who doesn't know how to reach out to a particular student, or for a parent who doesn't know how to control a child. Remember, it's not about controlling, but giving them the wings to do what they want to do. And just remember that structure is oxygen and support is what helps them navigate this phase of life in a more beautiful way. For anyone who has ever felt that they're too much, they're lazy, or they're not smart enough, you're not lazy. You're not dumb. You're just wired different. And it's a brilliant setup of brain that you have. And it's on us or our responsibility to understand how your operating system of the brain works. And that is what I want to talk about. Let's talk about ADHD as a neurodivergent talent and not as a disorder. And let us make sure we are more compassionate, we are more empathetic at our workplaces or our educational institutions, and not try to bully them or not try to tease them. Remember, they're not lazy, they're not dumb, they're just wired different. And I have worked with players as a sports psychologist for the last 7 years. I have had quite a few ADHD children working with me, and trust me, they are the best out there and high performers on the court. If you have found value in this episode, I would request you to share it with somebody who needs to listen to that they're not broken. It's just that they need to be a little structured. And on that note, thank you so much, Snigdha, for gracing this episode. Personally, I would be taking a lot away from this because I work with people who have ADHD, and most of the times parents put them into sports because they have ADHD,
right?
And they thrive well. And they do really thrive well.
I told you, they have different ways of showing their brilliance.
And I cannot take the names, but they're really doing well. And they're on international platforms or national platforms playing very well. And they're doing best in everything that they can do right now. So this is something that I would like to take away from. And I personally want to thank you for being so open about this topic and so passionate about this topic. Hope to see you soon, and thank you so much.
Thank you so much. The pleasure is all mine.